I'm Dr. Brazu. I'm one of the gastroenterologists here at Wright-Patterson Air Force Base. In this video today, we are going to go over the preparation for colonoscopy. Thank you for trusting us with your care. In this video, we are going to discuss colon cancer, the colonoscopy procedure itself, some of the bowel prep instructions to take before the procedure, and some special medication instructions that might apply to you. Here at Wright-Patterson Air Force Base, we have two gastroenterologists, Dr. Sherman and myself. On the day of the procedure, you will meet one of us. The colonoscopy procedure allows us to see the inside of your colon. Here are some examples of pictures of different parts of the colon that we will be seeing on the day of your procedure. The most common reason to undergo a colonoscopy is for colon cancer screening. The mass at the bottom of the screen is an example of a colon cancer that is being visualized during a colonoscopy procedure. To review some statistics related to colon cancer is the third most common cancer in the United States and is the second leading cause of cancer-related deaths. 1 in 17 individuals without colon cancer screening would end up developing colon cancer. This graph represents the age of onset of colon cancer in the United States. You can see a large spike starts around the age of 45 to 54. Most guidelines in the United States recommend starting colon cancer screening at age either 45 or 50. Colon cancers develop from colon polyps. Colonoscopies allow us to find polyps and remove them before they have a chance to become colon cancers. The first image is an example of normal colon mucosa. The second image is an adenoma polyp that during a colonoscopy we would be able to remove. The third image is an example of a carcinoma that has developed from a colon polyp. Colonoscopy reduces the risk of colon cancer by 70 to 80%. It also improves survival in the event that a colon cancer does develop. It allows for early recognition before it has a chance to spread outside of the colon. While colon cancer is the most common reason to undergo a colonoscopy, you may have been referred for a colonoscopy for several other reasons, to include bleeding, having abnormal abdominal imaging, having symptoms of chronic diarrhea, iron deficiency anemia, unexplained weight loss, or abdominal pain. Overall, undergoing a colonoscopy is a very safe procedure, but there are a few risks to know about related to the procedure. There's risk related to sedation causing decreased blood pressure and oxygen levels, but we will keep you closely monitored during the procedure. There's risk of bleeding if we remove any polyps or take any biopsies. Those sites can bleed. Most of the time that's going to stop on its own, but every so often we have to repeat the procedure to control bleeding. There's risk of perforation, which is where the scope goes outside the bowel wall. If that happens, we try to repair it while we're in there, but most of the time it would require surgery to correct. There's risk of us missing a small polyp that might be small and hiding behind a fold. There's always a risk of death, although that's extremely rare. Overall, the risk related to a colonoscopy is about 1 in 1,000. This is an example of a colonoscope that will be used during your procedure. It is thin and flexible and has a working channel in the center that allows us to put down the snare to remove any polyps and then retrieve them so that we can send them to pathology. This is a diagram example of a colon. During the procedure, we go up and around the colon to reach the end where it meets up with the small intestine. This is an example of the technique used if we do find a polyp during your exam. We use a snare device to remove the polyp from the surface of your colon. As part of the informed consent, we want to go over some of the alternatives to colonoscopy. There are stool-based studies that are clearly less invasive than undergoing a colonoscopy. They need to be repeated every 1 to 3 years, depending on the test. Their primary focus is on the early detection of cancer instead of on colon cancer prevention. If you have an abnormal fecal-based study, it requires a colonoscopy to evaluate. Another alternative to colonoscopy is a CT colonography. This uses a CT scan in combination with air to inflate the colon to get a virtual visualization of the colon. It does not detect small polyps or flat polyps and has radiation exposure. There's no sedation that's used for the procedure, and if a polyp is found, a colonoscopy is required. They need to be repeated every 5 years and is not available at Right Pat. The alternatives to colonoscopy are less accurate than colonoscopy at detecting polyps and colon cancer. None of the alternatives have the ability to remove polyps or take biopsies. Abnormal results require a colonoscopy to be performed. By undergoing a colonoscopy, you have the longest interval between screenings at 10 years. For these reasons, the American College of Gastroenterology recommends colonoscopy as the preferred method for colon cancer screening. Undergoing the bowel prep is the most difficult part of having a colonoscopy. There are some specific diet directions we recommend you follow. Starting 1 week before the procedure, you should avoid any nuts, seeds, or corn. On the day prior to your procedure, you should have a breakfast before 9 a.m. that is high in protein and low in fat. Examples include eggs and white toast without butter, or you can have a protein shake. Starting at 9 a.m. the day prior to the procedure, you need to switch to a clear liquid diet. You can have items that include water, Jell-O, popsicles, fat-free low-sodium chicken or beef broth, hard candies, and you should avoid anything that is red or purple in color. For the procedure, you will be required to pick up a prep from the pharmacy. Some things you can do to improve the prep medication is try refrigerating it, pouring it over ice, using a straw to drink it so that it doesn't touch your tongue, or you can add flavoring to the medication. If you add flavoring, I recommend doing it by the glass as opposed to adding it to the entire container in case you do not like the taste of the medication. Starting at 6 p.m. the evening prior to your procedure, you should drink half of the solution over 2 hours. You should have about 8 ounces every 10 minutes. Starting at 3 a.m. the morning of your procedure, you should drink the second half of the medication. Although it's inconvenient to wake up at 3 a.m., this is the most important part of the bowel prep. You should try to finish the entire solution by 4:30 a.m. Please review the handout for detailed instructions. This slide illustrates the importance of the split dose prep. Both of these patients took the same amount of bowel prep. The patient on the left took all the bowel prep the night before the procedure, whereas the patient on the right split the dose with half the night before and half the morning of. As you can see, it'd be much easier to find a small polyp in the patient on the right than on the left. If your bowel prep is not complete and we feel that we are not able to sufficiently detect small polyps, we will need to reschedule your procedure. If you have a history of constipation or have had failed bowel preps in the past, we ask you to call our clinic in advance so that we can give you additional prep to take before your procedure. Certain medications require some dose changes or adjustments prior to your procedure. We will cover the most common ones here now. If you have any specific questions, we ask you to please call our clinic so that we can review it with you. If you take an iron pill, we ask you to stop the medication 7 days prior to the procedure, as it will often cause constipation. If you take a blood thinning medication to include Plavix, Xarelto, Eliquis, Pradaxa, Brilinta, or Coumadin, we ask you to discuss the medication and the procedure with your prescribing physician, oftentimes a cardiologist. If you take a low-dose aspirin, you can continue that medication. If you take a water pill or diuretic to include Lasix, hydrochlorothiazide, or Maxide, you should hold that medication the day of the procedure. All other blood pressure medications are safe to take the day of the procedure with sips of water. If you have a history of diabetes and take oral diabetic medications, you should take the complete dose the day prior to the exam and don't take any the day of the exam. If you take glipizide or glyburide, you should avoid the medications both days as they can lower your blood sugar levels when fasting. If you take insulin, you should take half the dose the day prior to the procedure and not take any the day of the procedure. If you have any specific directions, feel free to reach our nurse so that we can review it with you. For the procedure, you will be receiving sedation. You should not drive or operate machinery after the procedure, and so should have somebody who can drive you home and take care of you afterwards. On the day of the procedure, you should dress comfortably and leave all valuables at home. If you have any additional questions, please give our clinic a call so that we can answer them for you at 937-257-5457. In addition, we ask you to please contact us if you've had a colonoscopy in the last 5 years so that we can verify that you need one at this time. Thank you for watching this video, and I look forward to meeting you on the day of your procedure.